Hello, 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 and welcome back to the IBS Freedom Podcast. I am joined once again by the amazing, beautiful, and talented Amy Hollenkamp.
Hello, people.
I'm all about the jazzy fingers lately.
Yeah.
I don't know if you've
You're
noticed
really
that,
jazzing it up.
it adds a little bit of pizzazz. And once again, we will mention, if you're not watching the video version of this on YouTube, man, are you missing out? Because you miss things like the jazzy fingers. But I digress. You're here now in whatever capacity you are, and that's what matters because you probably want to feel better. So let's get into that conversation. We broke up with SIBO a couple of episodes ago. If you recall, for those of you who might be new, the gist of it is that we discussed how SIBO breath testing is so inaccurate, it might be not only a waste of money, but it might be over-diagnosing SIBO and incorrectly telling an awful lot of people that they have SIBO when in fact they do not. So a lot of you are probably now kind of scrambling and wondering, oh my gosh, we're back at the drawing board. What do we do now? And you're kind of back at this really sucky place of, oh, I just have IBS, right? And some of you have been told those exact words by your doctor, by your GI doctor, or whoever. So we wanted to do an episode just about that topic, about the idea of just having IBS. And what could you do if you don't have SIBO, if you don't have Crohn's or colitis or celiac disease, if you have run-of-the-mill, garden variety, still totally sucks, IBS, what sort of things should you be doing and what can you focus your effort on? And that way, I feel like less of a meanie taking away that SIBO label from you. So, Amy, you want to open us up with that?
Yeah. In terms of being diagnosed with IBS, I do believe, if you go to a functional medicine doctor, they're not going to diagnose you with IBS, typically. You're going to get that diagnosis from a conventional practitioner. And usually the conventional options for IBS are very little, like maybe an antispasmodic, maybe a few meds that could help if you have constipation or like antidiarrheals. But rarely do you have many options that are being presented by the conventional sphere. Now then you go to the functional sphere and it's, oh, you have SIBO, you have candida, you have a parasite, you have leaky gut, you have all these things that are underlying your IBS. So when it comes to the IBS diagnosis, it doesn't really tell you a whole lot. It's pretty broad. And again, that's, I think, where the frustration comes in sometimes with the IBS diagnosis. But again, like you were mentioning before, so many people are being overdiagnosed with SIBO and, gut dysbiosis and like, again, all these things like they'll get a GI map and it'll have one marker that's high and it's like, let's obliterate this to kingdom come. So there is a knee-jerk reaction in the functional space to put a label on what is underlying your IBS, which even again, if it was SIBO, there's still things underlying the SIBO. So sometimes they don't even go far enough. It's very strange.
Well, it makes sense because that's kind of the brand of functional medicine, right? Like conventional medicine didn't dig far enough, and we're going to come along and we're going to tell you what your root causes are.
Right.
And we're going to diagnose or label all of these magical, mysterious things that conventional medicine either doesn't know about or won't diagnose. And that's a big part of the marketing powerhouse behind functional medicine is, we're the magic wizards who could do this. And it's not to say that that's invaluable. The problem is when the testing is not valid.
Right.
Right?
Right.
Like, I could make up some BS test that diagnoses a new thing, like pseudogastric intestinal fasciculation syndrome. Yeah. Like, I could make up something and just make up some PS lab, and that doesn't mean it's valuable to the patient to get diagnosed with that thing. right?
Right.
So we have these tests that are overdiagnosing candida, overdiagnosing leaky gut, overdiagnosing food intolerances and food sensitivities. And now we're realizing that SIBO is probably very much getting overdiagnosed. But again, you still kind of land in that sucky place of IBS,
Well,
and that's going to look different for everybody.
yeah, not to cut you off, I'm sorry, but I it's not to say that the symptoms are any less, life altering or hard to manage, because again, I feel like we like labels. We like the idea of having just this linear thing of
Clarity, certainty.
right, clarity, certainty. But again, when it comes to IBS and gut related symptoms that are clustered within the IBS model, so bloating, diarrhea, constipation, or alternating, indigestion, like bloating, gas, that kind of stuff, when it falls in that, or pain. So when it falls in those types of symptoms, again, IBS is this broad umbrella, and even SIBO was an umbrella. If you truly have SIBO, you'd want to figure out like what was breaking down. That would be driving the SIBO. But same thing with the IBS. It's like the label doesn't even mean that much. Like even the SIBO label, like
Yeah.
Again, these things seem so huge because it's like, that's it. But in reality, there's so much more exploration besides these labels. It's like, typically, I think most of the time, the clients that we see, it boils down to a lot of motility issues, dysbiosis, more so than like an overabundance. Or you could even word it as an overabundance of opportunistic type bugs, and less of good bugs, but not necessarily like an overabundance of total bacteria.
Yeah.
Not
like the SIBO model.
Right. The current
quantity
SIBO model.
overall.
Right. So yeah, I mean, it feels good sometimes to have a label, but in reality, if you look at all the labels, they don't really mean that much. The good thing about the IBS diagnosis is that it does rule out the big scary things. So the cancers, the ulcerative colitis, the celiac, the Crohn's, which again, the IBS labels pretty much says, okay, you have these cluster of symptoms, but it's nothing serious that we can see.
In the sense of life-threatening.
Right. And like, okay, be on your way a lot of times is how the conventional system does it. And maybe a good provider might suggest some dietary interventions or send you to work with an RD, or maybe try a few meds that might help symptoms, but that's pretty much all you're going to get. So there is a benefit of knowing that it's nothing, again, life-threatening. Still can be very painful and annoying and life disrupting to have these symptoms. Still sucks, but it is helpful to know that you don't have to worry about like a life-threatening thing going on.
Yeah. And, I will say, I think the internet, like the gut health space on the internet in general, and the functional medicine community, both will kind of get in our heads with this idea that, oh, the IBS label is bad or it's worthless and like it's unacceptable. Don't stop there. Oh my God, you have to dig deeper. What's your root cause? IBS isn't a real thing. And again, like I get some of that. I get, and I love the idea of getting down to what's really going on with your body. And not just writing it off as like, oh, you have IBS. You're just doomed to be bloated and have weird poops for the rest of your life. Haha. And move on with your life. I do think that there's more that can be done. But I think sometimes like that messaging gets people in this mindset and on this quest of, I need to know all the things that are wrong with me. And again, I need to have what feels like objective truth.
Right.
And that's where we start getting really obsessed about the testing And I just saw a YouTube video, no joke. 2 days ago, I saw a YouTube video. The guy is a clinical herbalist. I don't know what that means exactly in Australia, but he just posted a video the other day. Don't skip SIBO testing! Exclamation point, exclamation point. And, it's like, there are some tests that we can skip, but again, we have these resources and these authorities out there that are telling us, oh my God, if you don't test, you know nothing and you're never going to get better.
Right.
It goes back to the test, don't guess episode, right?
Right.
And it's just feeding into that fear mongering. And I don't think that that's serving a lot of people. Now, I will say, doing a stool test might make sense for most people with IBS, just to kind of take a peek and see if you can find anything under the hood. I think doing another one and 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 going on this quest to find like the one that gives you the answers is a slippery, dangerous slope. But maybe taking a peek under the hood, at least attempting it once, is reasonable. Certainly doing some more of like the conventional medicine labs. So checking your ferritin, checking, your CBC, your thyroid, especially if you have constipation, checking on, vitamin D and some inflammatory markers. Maybe if you think you're deficient, testing vitamin B1, which can be done through LabCorp and Quest. I could get behind a lot of that type of testing. But as far as the functional testing goes, I really don't think everybody needs a GI map and a Dutch and an adrenal test and a whatever test. I don't think it's practical, nor do I think that they're so accurate and so wonderful that everybody needs them.
Yeah, and I do think that what I see often is practitioners even just overriding the test too. Like if it doesn't turn up what they think it will or what the symptoms are presenting, they'll just throw the test out to begin with. And
it's
in
like,
those
why
cases,
did we do it then?
Right, exactly. I don't get it all that much. But
yeah,
I think you're right. Like it begs the question of, the majority of our clients fall into like an IBS box, meaning they have a lot of the symptoms of IBS. And again, maybe they're diagnosed with IBS, maybe not. Again, maybe they've more gone functional and they've been diagnosed with SIBO. But I think you can potentially learn from, you have people that are diagnosed with this particular syndrome, that's this cluster of symptoms. Like, what do they have in common? What sort of things generally help those people with that particular diagnosis? And again, it's so nuanced too that, again, we don't really like protocols or one thing to meet each person, but there's still patterns. So you can work with someone with IBS that, has a very like stress pattern, that looks like they have kind of maybe some cortisol dysregulation and they're just hyper stressed. They probably have some nervous system imbalances from that too. Maybe they're under eating. Again, you could get some patterns for people, or again, like another person, maybe they had food poisoning and that could create a different pattern of underlying breakdowns. So there are these patterns that you see when you've worked with people within the IBS SIBO space. And again, I don't necessarily get so hooked in on the individual diagnoses. Again, I'll have people now that are like, I have SIBO, I have candida, I have leaky gut, and it's like, okay, well, cool. What are your symptoms? Like, yes, I'll look at your labs, but, I think the longer that I've been in this work, the less some of those things mean to me in terms of like what I'll do with the person.
Me too.
Which is so interesting. Someone's just like, I for sure have leaky gut. And again, maybe there are markers of like inflammation and it makes sense. Maybe they have some permeability. But yeah, I think the labels are less important and interesting to me compared to, what their patterns are and how things progressed and what things have generally helped, like actually just digging into a lot of the qualitative data.
And what you're kind of describing is, I think that this is the nature of a lot of research, right? So I think on the one hand, medical research is trying to find the one cure, the one holy grail for each condition.
Right.
So, they're looking for 100% efficacy in a group of people with the same diagnosis. But I think a lot of research, especially with complex illness like IBS, a lot of research is just looking for something that helps a good chunk of those people. Because I do think that on some level, most doctors and most researchers understand that IBS isn't the same for everybody. And it's actually going to be a lot of different stuff kind of thrown into one diagnosis, or like migraines are not the same across the board. So, what you said, if there's an intervention or an herb or a supplement or a medication that helps, 50, 60% of people with IBS, it's not to say that it's going to help everybody, but it's worth a shot, especially if the risk-benefit analysis is pretty good. And it's, obviously if it was like strychnine helps 100% of people with IBS, you wouldn't do it because that's going to poison you.
Well, yeah, I think again, like it's a flavor thing. So there's different flavors of IBS. So again, we work with a lot of different flavors of IBS. You might have someone who is in a very stressful job, doesn't get much sleep, who might benefit from doing like some nervine herbs, working on sleep, maybe trying to set boundaries around her job. Whereas
Therapy,
again,
possibly.
another person, who pretty much has like a pretty balanced life, but has had wicked post-infectious issues, might need some ginger or some prokinetics. Maybe they are working a little bit more on microbiome stuff. So again, there's these different flavors to think about based on what someone's history has been. But I think that's the core piece. It's what has the person's history been? What
You don't need testing for 90% of that.
Right.
If you take a good history.
Exactly. You don't need testing for most things.
Well,
and again, I think go ahead.
I was going to say you go ahead.
I think again, the testing can often be helpful too to rule out things like what you're saying, like ruling out thyroid issues or ruling out iron deficiency or some of these things. But
those things
I think the conventional stuff is much better at ruling out stuff versus the functional is like trying to find the boogeyman or find sort of like the holy grail type thing. I don't know.
Well, I think that there is this additional element with testing to consider. If it's a small or a medium-sized like functional laboratory, a lot of their decisions, a lot of that company's behavior is probably going to be built around turning a profit, right? Because they're a relatively small fish in the sea. Versus, I'm thinking like LabCorp. LabCorp and Quest are in virtually every hospital in the country. They're fine. They're doing okay. Nothing's going to happen to LabCorp or Quest. I'm sure that they would like to turn a profit, but they've gotten so big that they don't need to stress about it quite as much, I would imagine. And they could just kind of operate and do their thing. And the sheer volume of testing that they do, if you look at something like TSH or T4 or ferritin, they've run that probably billions and billions of times now. Versus, I know everybody and their brother thinks that the GI map is the most amazing test ever. And like everybody thinks that the Dutch test is the most amazing test ever. But those companies, these functional companies, are much smaller fish in the grand scheme of things. I think they're a little bit more in like survival mode and trying to make a profit still and trying to establish themselves in the marketplace. But that also means that there's more of a likelihood there's going to be a lot of slick marketing, or there's going to be a lot of like salesy kind of tactics. And I don't know. I just think that can cloud things a bit. Like I go to a lot of functional conferences and seminars, and I'll tell you all of these lab companies, all the popular ones, Vibrant America, DSL, the Dutch company, Great Plains, all of them go to all the trade shows, all the conferences and the seminars. Oftentimes they're offering some sort of coupon code or a promotional thing, or they might even give away a free kit to each doctor or each person who attends the conference. They do that at IFM a lot. And you start getting into this weird world of like, this is the behavior that big pharma is doing in the conventional medical world, right? Like big pharma, the reps go into the offices and try to convince the doctors to order more of the Lipitor, and then they're giving out free samples of the Lipitor, and they're like checking in on the sales for that individual doctor to see if they're increasing their prescribing rate. And the same thing happens with lab companies and supplement companies in the functional medicine space. It's the exact same behavior, and they took that page directly out of the big pharma book. But for some reason, my profession and just people in general are okay with that behavior when it's a supplement company or a lab company, but we are absolutely repulsed by it when it's, Pfizer or whatever. And it's such a
Moderna.
Hypocritical thing.
Yeah.
But I don't want to beat this dead horse too much more because we have a whole episode on test, don't guess and the drawbacks of testing. But again, just going back to where people are at these days, assuming that a lot of you thought that you had SIBO, and now maybe you're questioning that a bit because of that episode that we did and the YouTube videos that I published with the deep dive on the data, and just wondering where the heck are you now? So again, I think that just getting some really basic labs to screen out some of the basic unsexy stuff would be really helpful. We could certainly make the case for going back to the unsexy, unglamorous basics, right? So you mentioned sleep and stress. And the irony of this too is that, going back to what you said, the label doesn't matter. Whether you're getting a label of IBS or SIBO, it almost doesn't matter at the end of the day because, if I have two patients, one patient has IBS, one patient supposedly has SIBO. If I look at two patients and they have different diagnoses, but their sleep sucks, I'm still going to work on the sleep. Or similarly, if I have two patients, even more extreme, like if I had a Crohn's patient versus an IBS patient versus a GERD patient, and their stress is like 10 out of 10, and their anxiety is 10 out of 10, and their mental health is in the toilet, and they're just like scrambling to keep it together, we're going to talk about that. We're going to talk about it. I'm going to encourage them to go into therapy or get some more coping skills, maybe meditate, take some Nervines, take some adaptogens. The treatment can be remarkably similar even amongst people who have wildly different diagnoses. But what's kind of frustrating and kind of ironic is that the functional medicine world, when you go to these seminars and you hear them talk and you hear like Mark Hyman or whoever talk, their whole shtick is, well, we treat the person, not the disease. And it doesn't matter what disease you have. It matters what person has the disease. And they have these quotes that they love to throw around. But I have found that not to be true with functional medicine at all. Like, it may be in the initial screening process, they will ask you about hormones, they'll ask you about nutrition very briefly, they'll ask you about autoimmunity and symptoms. But no matter how thorough their intake process was, the minute you get a diagnosis of like SIBO or leaky gut or something specific in the gut, the moment you get that diagnosis, it's like nothing else matters. And they hyper-focus on the GI tract because all disease begins in the gut, which is a topic we've discussed before. So it's weird. It's like the first appointment, they do live up to what they claim, and they focus on all the body parts and they do a thorough kind of assessment. But then once you get that initial data back, especially if it's something having to do with the gut, it's like everything else goes out the window. What I find and one potential direction for people to take, what I found is that I was very disappointed with functional medicine in that regard when I had that epiphany that was happening. And I felt a little bit robbed because I got into functional medicine hoping that it was like they say it is. What I found is that herbalists, generally speaking, do a much better job of that. Like, they really are looking at the body in its totality and they're using herbs in a much more holistic way. So if you crave that experience and you haven't gotten it from the functional or the naturopathic world, and you're kind of like WTF, they're just hyper focusing on the gut more than probably is appropriate. I'm drinking something carbonated. I'm having kombucha because I have a sinus infection and I want to get more probiotics in. And also I just love it. So it's an excuse to get one of these. But the carbonation just caught up with me and I had like the babyest burp. I'm sorry, people. Don't
apologize for your baby burps.
Once again, you get what you get on the IBS Freedom Podcast.
Right.
But anyway, I was just going to say, if you have had that experience, or if you're otherwise frustrated with the lack of holisticness in the naturopathic or functional or integrative field, you might consider finding an herbalist in your area, like a bona fide herbalist with no other accolades potentially, and just going that direction instead, because I find that they honestly do a much better job at treating the body holistically. It might not always make as much sense, because at least in the functional space, they're going to give you the shiny diagnosis, and they're going to give you like the piece of paper with the functional tests, the god-awful expensive testing to prove what you have. And herbalists generally won't do that because they can't order labs in the United States. But yeah, that is more of the experience that I expected when I got into functional medicine. So that might be something to look into. And as a bonus, herbalists are usually a lot cheaper than functional doctors. So
yeah.
Just for what it is.
Yeah. And another point too about, from a label standpoint, it being, or just from a mindset standpoint, how you're thinking about this. Because I think a lot of people like having the idea of, oh, I have this thing. But whenever I talk to someone, and we've talked about this, usually everyone has a pie. So there's different things that are going into whatever this IBS diagnosis is. And whether you have that label or not, those are still the pieces of the pie that could be driving the symptoms. So again, like same thing with the SIBO scenario, like if you're having a cluster of symptoms, we're reviewing your case and we're seeing different patterns and different factors that are at play for what's driving those symptoms. Whether you have the SIBO or the IBS diagnosis, it doesn't really matter. It's like you still have this pie of different factors. And honest to God, I think the draw of having a label is to say, oh, I have IBS or I have SIBO, I'm going to do this one thing that'll work. That's the draw. Unfortunately, again, like we've said
magic bullet.
A bunch of times, there's no magic bullet, because even if we can locate all the factors that are driving the symptoms, usually out the gate, it's really hard to determine what's the primary factor or like the biggest factor, what's the smallest factor. Usually it takes some degree of experimentation. But
that's the thing. You're going to have to experiment regardless of your label.
Right.
And regardless of your test results.
Exactly.
I'll pose this to you, and I might have mentioned this in the Test Don't Guess episode. Even when we do testing, we're forming a hypothesis. And the hypothesis is that the abnormal, out of range thing that we're seeing on your test is the cause of your symptoms, or it's a contributing part to your symptoms. So if we do a test and we see candida overgrowth on a test, we are kind of quietly, not really acknowledging it, but what we're doing is we are hypothesizing that candida is directly contributing to your symptoms. And the way that we test that is through experimentation. And what you need to do if you have that situation where, you have a test result that says you have candida, the next step is the experimenting. And you need to say, okay, well, let's do an herb or a supplement or a strategy that would benefit somebody who has genuine overgrowth of candida. And then we're going to watch and wait and see how you do. If you feel better on a candida protocol, generally speaking, I think that adds to the hypothesis and it makes it more likely to be true. If you do a candida protocol and you don't feel any difference, then that detracts from that hypothesis, right? Mm-hmm. And then I think we talked about this recently too. You might then say, well, that wasn't the right supplement or the right candida protocol for me. Okay, fair enough. So maybe you do one more candida protocol or supplement. well, same thing. If you feel better on that Candida protocol, then that strengthens the hypothesis. If you go through, 2 or more rounds of targeting something and you feel no different, I've got news for you. That's not the thing that's contributing to your symptoms. And there's research on this with SIBO too, keeping in mind that Lord knows what we're looking at with research, because the way that they are labeling SIBO in the research is all over the freaking place. But there's so much research where people get diagnosed with SIBO and then they get treatment and they actually feel no better from the treatment. And, it's something that we've observed in research for a long time. And I think the tone in the research is like, isn't that something? But I feel like I'm reading these research articles and I'm like, yeah, because the person probably did have SIBO. Or
Right.
maybe they have SIBO, but it's not contributing to their symptoms for some wacky reason. There are people walking around with abnormalities and they have no idea and they're asymptomatic. And it's a real mindfuck to try to figure out why. Like in the low back space, to kind of tangent off on this, there are a pretty outrageous number of people walking around with herniated discs in their low back, and they do not have any symptoms. They don't have the radiating pain into the legs, the neuropathy, they don't have the back pain. They are asymptomatic, even though we can clearly see on an MRI that they have a herniated disc in their back. But then we look at people who have the radiating nerve pain and the back pain, and we do an MRI and we see the herniated disc. And again, we're making this assumption, see, you have a herniated disc. That's what's causing your symptoms. We found it. We did it. And it's like, well, is it? I don't know. You have to treat the disc and see if you get improvement. And if you do not, then you need to pivot and move on to something else. Even though you saw it clear as day on the MRI, even though you have visible proof and like we could cut you open and we could put a camera in there and we could see the herniated disc, we could see the bulging disc. It is there, it is real, it's not a figment of your imagination, but it's not always directly contributing to your symptoms. It's not always a bad thing. Sometimes people's bodies just learn to cope in mysterious, weird, amazing ways. So again, you have to be open-minded to doing some experimentation, and you could do that to some degree with or without testing, or with or without clinical guidance.
Right. Well, and there's so much that someone could do. I think what gets challenging is knowing. I think with some of our clients, they get so wrapped up in the nitty-gritty details of the testing and everything that they just lose sight of the basic stuff, or think, I'm like too far gone. Stress isn't it? I'm like, it's not just stress. But then how would you know if you've never worked on it and you've been stressed for the last 20 years? So it is interesting. I do wonder too. I know we've talked about it in some of the OCD episodes we did earlier. But I almost wonder if there's a proponent or a higher percentage of people with IBS that have more of like obsessive, like where we can obsess over like somatic things that are happening in the body, or hypervigilance. I know we've talked about this concept before, but, as a subset of people with IBS too, like we also could be potentially more hypervigilant of sensations within the body. That's where you get like visceral hypersensitivity. But I think that also plays into this sense of wanting certainty, like wanting that linear diagnosis, and then there's a linear solution. And we're always looking for that needle in the haystack moment of like, huzzah, see what I found, like I found it. And again, because I think a lot of people with IBS are wired in that way, me included, wanting that certainty, wanting that really clean, crispy diagnosis that tells us what to do. And that's the promise in especially the functional space is, we can find that needle in a haystack. So it's very appealing to someone that has more of like a higher anxiety, OCD-ish slant, like I do. But yeah, I just wonder. I don't know if I've looked this up, like the percentage. Maybe we talked about it. Maybe I did look it up at some point. But I do think, there's people. I know that I had some hypervigilance towards symptoms. And again, even just like tracking your symptoms could lead to more hypervigilance too.
Oh, you can get obsessive about that for sure.
Right. Checking in on your body and what's going on with your body. But I think the same type of person that's a little bit more hypervigilant is also going to want the certainty of like a proper, what would be considered like a proper label or a proper diagnosis.
Definitive diagnosis. Yeah.
So yeah, again, it's
well, you make a good point. I think that there's probably two parts, and I think probably both are going to be there with IBS, if I had to guess. And I know the research on one side, but not the one that you have proposed. There's the hypervigilance side of things where you're checking in, you're like doing body scans, you're kind of paying extra close attention to your body. And then you're, every little sensation, you're like, oh my God, what was that? So there's that element of like visceral hypersensitivity and that sort of stuff. I would bet that you're right. I think that probably is more prevalent with IBS. Certainly a lot of people with IBS have anxiety.
Right.
And, what you're describing there kind of goes hand in hand to some degree with both anxiety and OCD. So it's all kind of a similar flavor at the end of the day. So I think that there's a big piece of that that's like mental health, medically induced trauma kind of wrapped up into one. Then there's also what we've talked about, I think, before, this visceral hypersensitivity from the angle of your nervous system not controlling these pathways adequately. So I think I might have shared this in I'm pretty sure we did a visceral hypersensitivity episode, right?
We definitely did. Yeah, recently.
Okay. I don't remember what episode it was, but we definitely did one. And I might have shared then, but I'll share it again. I had chronic low back pain for 5 years. I had no injury that I was aware of. The only thing I could think of was that I was a rower, and rowing is notorious for destroying people's backs. But I never had an acute injury. I never, threw out my back or did anything really bad to it. It was just like one day this pain started. And in retrospect now, a lot of years later, I look back and I think that what was happening is something called the pain gate, I think, was off for me. So the idea is in neurology that you have pain signals called nociceptive signals. You have these nociceptive neurons firing off pain signals everywhere in your body all the time. Like all the time. They're firing off pain. But you don't constantly feel pain normally because all of those signals have to get up through the spinal cord and they get to the brainstem. And there's a part of your brainstem called the paraaqueductal gray that's called the pain gate. And it's kind of like the bouncer before you get into the club, right? Like everybody wants to get into the club, but only a select few VIPs get to go in. And in this case, the club is the brain. So you have all of these thousands and millions and gazillions of nociceptive signals. They all want to get up to the brain, but that pain gate in your brainstem is keeping them in check and saying, no to you, no to you, no to you, hell no to you, you're not real, no, 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 no. Oh, this one's real. You go up. You go up to the big guy upstairs, and then that's what you ultimately feel as pain. If these nociceptive signals stop at the spinal cord or the brainstem, you never perceive them. You don't feel the pain. So I think for me, what was happening is I think that there were normal nociceptive signals coming up from an area that maybe had some degree of stress or inflexibility because of my sport. But I think that it was these normal nociceptive signals. And then because I had had a concussion and I had some inflammation stuff going on at the time, I think that just more of those pain signals were getting through the bouncer and getting into the club, into the brain. And I was perceiving pain even though there was no tissue injury there. And the same thing I think can happen with fibro. And the same thing probably can happen with visceral hypersensitivity, where either the neurons in the gut are hyper responsive to pain. So like maybe because of histamine and mast cells, for example, that's been pretty well established. Maybe because of estrogen modulation in the gut. I think that there's that piece of it where the nerves inside the gut are hyper responsive to pain and stimuli. And then also maybe there's a pain gate issue where more of those signals are getting through to the brain and you're perceiving them way more than you normally would.
Yeah, well, I think the thing that's interesting is there could be some degree of pain, but then if you're hyper focusing and hyper scanning on that pain, it's going to make it bigger.
And that's been shown in research too.
Right. So that's the hard part. It's like not most of the time when people have IBS, it might not be that it's just you're imagining this pain or whatever. It's not usually that. Usually I think something going on, and then you zone in on it. It was funny because I just recently talked about this with a therapist on OCD, and she described it so perfectly of what OCD feels like, or again, anxiety. She would argue that they're basically rooted in the same dysfunction, but when you have like a fear triggering in your brain, she likes to describe it as if you went to like Google Earth, like your world is the whole Earth. And then if you zoom in, and then it's like it zooms in on your state and then your city and then your house or whatever, how it can kind of zoom in really, really to something really small. That's how anxieties and like OCD are. So if your whole world, you have a lot going on in your life, you have a big old world, and then all of a sudden something triggers that fear. Again, whether it's the fear of symptoms that you've had in the past, maybe again, you've had SIBO before and you ate something a little out of the ordinary and you're noticing that you're a little more bloated, triggers the fear in the brain, and then you zoom in on that fear, and it's hard to zoom back out and see like, oh, I have a lot going on, and it's not just this issue or this pain or this bloating. So I liked that analogy because having gone through OCD and anxiety type things, that's what it feels like to me. It goes very broad and then it just hyper focuses on one little thing.
Yeah. And
I definitely think that was at play in my personal IBS case. Now, again, I don't think every person with IBS is hyper focusing, but I do think there's a degree of it, a high degree of it when I work with people, even just talking through like how they're checking symptoms, things like that.
Well, and I think twofold. Oftentimes healthcare professionals tell you specifically to do a lot of body scans. I just saw a video the other day. I couldn't help but comment on it. I'm a YouTube geek. I'm on YouTube a lot. And I couldn't help but comment on this. But there was a video from Dr. Berg, who I disagree with some of his nutritional philosophies, but sometimes he puts out decent videos. And I generally try to check them out whenever they're posted. He did one on that stupid test. I forget what it's called, but are you familiar with this? Where in order to test if you're sensitive or allergic to a food, you take your pulse.
Oh, God.
And then you eat the food. And then you take your pulse again. And if it increases by a certain amount, then you like have an allergy to that food. They taught us that in the Nutritional Therapy Association. I think the curriculum has come a long way since I went through it, thank God. But they taught us that. And I remember thinking that was the biggest crock of manure. But also, even if it is accurate, the risk that you're going to make somebody hypervigilant and totally like, I've had patients like this where they're checking their pulse before and after every single meal for the rest of their life. And it's become an obsession. And that's no way to live. So on the one hand, I appreciate free and cheap tools that can help people feel better. I appreciate the idea of taking health into your own hands. I love all of that kind of stuff. However, we've got to be careful with the free and cheap tools that we tell people about because it's really easy to turn it into an obsession or just something habitual that they do all the time. And then it's to their detriment and it's making them actually sicker. And they're hyper-focusing on something that they don't need to hyper-focus on. Yeah, this was just like in the last week or so, as of the recording of this video, at least, that he posted that. And the biggest eye roll when I saw that.
Yeah.
Yeah. I forget. There was something else I was going to say, I think. And then I totally derailed from whatever that other thing was because I got focused on the Dr. Berg video. But let's kind of wrap up the last bit of this episode with maybe some supplements or some herbs or some strategies that people could use. So our next episode, we're going to talk about tailoring the IBS diet. So stay tuned. I know we've got an episode about IBS diets where we talk a bit about low FODMAP and SCD and so forth. We're going to frame the next episode, or at least I vote we do, more of like kind of walking you through step by step. You're a person with IBS. Here's kind of the hierarchy of what you should go through. So that's the next episode. But let's focus a little bit on some strategies and some herbs and supplements. You already alluded to this, but going back to what we call the unsexy, unglamorous basics is huge. If you kind of zoom out and you're like, okay, sleep, movement, stress, nutrition, and you basically just identify which of these main things could use some work. You know, like, is your nutrition dialed in really well, but your sleep sucks? Is your nutrition and your sleep great, but you never ever move your body and you're a couch potato, or you have a really sedentary job? Are you managing the other three really well, but you know damn well that you're stressed, or you have a lot of like medically induced PTSD to work through? So just kind of zooming way out and seeing the forest for the trees is, I think, the first step. And
Can I?
Yeah.
Oh, I wanted to add one other thing before we move on from the basics. Yeah. One thing to consider too, I've debated on asking, or when I work with someone, I can usually ask and figure this out through questions and interviewing the person. But I find sometimes people are unaware of how stressed they are, or they just... So sometimes even asking someone that you're close to, that you trust too, even being like, hey, like, where do you think, like, do you feel like I'm a good stress manager? Even someone that is a good stress manager, I do think asking someone who's close to you that might be good at what you are asking about, or that you feel like is pretty balanced. And I think you can tell them to be honest or whatever. You know, how do you feel like I'm doing stress management wise? It could be a spouse, it could be like a parent, or it could be like a sibling, friend, whatever it is. But I often wonder that, you know, because I know we've talked about this where we'll talk to someone who's like, I'm not stressed. And it's like, whoa.
Hi, my name is Nikki. I need to join this club.
Right.
Like I told you my acupuncture story that I went there and they moved my liver chi and it made me have a freaking nervous breakdown. And I was like blubbering and crying. And I went home and my roommates were trying to figure out what was going on. And they were like, well, are you stressed? And I was like, no, I'm not stressed. And then I thought about it and I was like, oh, actually, I'm hella stressed right now.
Right.
How did I not know? And that's kind of the beginning of when I realized that I just take any stress and I shove it down deep.
Right.
And I'm to a point where I'm consciously not super aware of it. That's a really interesting idea to have them ask a loved one. I think you could have them ask a loved one, scale of 0 to 10, how high do you think my stress level is right now?
Right.
And B, how do you think I'm coping with that stress?
That's good.
You know,
like
again,
idea.
Scale, and maybe you could do different scales, like A, B, C, D, F.
A little bit of a, I don't know, an easy way to answer back. But yeah, it's interesting. The more I work with people, the more you see sometimes people just really don't understand, or they're just oblivious of maybe how stressed they are, or even some people will tell me, oh, I can survive on like 6 hours of sleep. I'm good. And it's just like, are you? I don't know. I don't think you
There's
are.
A lot of denial.
Right. So sometimes it's helpful to have someone that can call you out on your BS at times. And so if you have someone that you feel like can, and BS is strong, but like call someone you out on maybe something your horse blinders are up on, or that you're just unaware.
I'm comfortable calling it BS.
Okay.
I'm calling it BS.
But yeah, I think again, everyone, has their own biases. So if you can get an objective opinion from someone else.
Well, and interestingly too, I like this idea a lot. I might actually do this with my patients too, because here's a weird thing. You would think that like a medical provider or a healthcare provider would be able to give you this non-biased opinion. But A, they don't know your whole life and they don't see it play out all the time. But B, even honestly, when I try to bring up the stress thing, sometimes I get nervous because I've had patients straight up like lash out at me because when it's coming from a healthcare professional and they bring up the idea of stress, sometimes that immediately like triggers people and it translates into, oh, it's all in your head. And it can be really difficult for a healthcare provider who's not in the mental health field to bring up stress because people get so defensive about it. Like, A, they might lash out, as I've had that happen before, even trying to bring it up like really gently and like I'm trying not to be an asshole about it. And I'm kind of, I think I'm presenting that question as well as I possibly can, and people still freak at me sometimes.
Right.
But yeah, asking a loved one and then just super promising them that you won't have a conniption fit if they give you a bad grade. So again, I would say 0 to 10 is the scale for how high do you think my stress is, or how stressed do you think I am? And then I personally would do like kind of a classic grading system for how do you think I'm handling the stress, A+ through F minus minus.
Right.
So yeah, I think that might be something that I start doing with some of my people too.
Yeah.
Because yeah, maybe they would know better than you. I think my roommates in that acupuncture story knew damn well that I had a lot going on. Like they knew that I was stressed before I knew that I was stressed.
Right. Them saying, "Are you stressed?" was just trying to pull it out of you and acknowledge that you're stressed.
And again, initially I said, no, I'm not stressed. And I remember being like a little bit pissy with them. And then I realized, oh, crap.
Yeah, well,
yes,
we're usually more defensive about things that ring somewhat true.
Yeah.
Typically, I would say.
Well, that's an excellent point. I really like that. But going back to the unsexy basics. So for stress, I like this idea of asking somebody close to you, or you could even ask a couple of people and get kind of a consensus idea. But the people who are closest to you and they know most about what's going on in your life and the people who you've like opened up to the most, they're probably going to be the best judge of that for you. If stress is a major contributor for you, then thinking about, there are a lot of wonderful herbs for stress. We did 2 episodes on some of them, the nervine herbs. If you look back in season 1, there's also adaptogen herbs, but even something simple like chamomile tea or just some ashwagandha capsules or something can go a really, really long way. Certainly therapy, reconnecting with hobbies and passions and people that you love and like social outings and just trying to get out of your own head, get out of your house and go socialize. That can be a huge thing. I have found for the people who resonated with the story of not knowing that you're stressed, I have found that acupuncture is really helpful for that. And actually, I have an acupuncture appointment booked on Friday this week, and I'm super excited. The acupuncturist looks super legit, so I am pumped. But I'm going to tell her, oh, heads up. Several times in the past, I have just erupted into tears on the acupuncture table, and I think it's always because of high stress, and I've had just a weird 5 or so months of a lot of stress. So I could just see the writing on the wall. I think Friday might be another one of those days where like she moves my liver chi and I'm just on the table.
My gosh.
So I'm going to give her a heads up. She's probably seen it before, but I'm just going to give her a heads up that may or may not happen. But acupuncture can really start to move things that you have buried deep and help kind of bring it to the surface so that you can process it and move on. did I say therapy? I think I said therapy, right? Even things like hypnosis. There's a lot of options. Even exercise to some extent can help with stress management. Do you want to take the next one? So that's what I have on stress. Do you want to take either movement or sleep? Those are the other two big ones aside from nutrition that I think we wanted to touch on.
Yeah, I mean, I think movement wise, you don't have to do anything extreme. Sometimes people just don't get into movement because they think you have to be doing something for 60 minutes every day or something like that. So if you're someone that struggles in any of these areas, whether it's movement, whether it's stress management, the best thing you can do is take baby steps towards a particular goal. So from a movement standpoint, I do think it's really important. There's some of my clients, though, that might need to work on some other things first, depending, or not that they can't move, but if someone's lost a lot of weight or something and needs to focus on nutrition before they can really dive into a movement routine or doing anything moderate to high intensity, that's something to consider as well. So depending on where you're at in your journey, you might want to just be a little careful with how you're moving. But if you're generally feeling pretty good and there's not like a ton of weight loss and tons of extra stress elsewhere, you could do a little bit more high intensity or moderate intensity stuff depending on how your body handles it. But I think for the most part, like the easiest thing you could do would be walking, maybe yoga. Some of these kind of lower intensity exercises can be great to get into movement. And then too much movement could also be problematic depending on the person.
Overtraining is definitely a thing. So
yeah, I think runners to me are just a bit of a different breed. I say that my dad's a runner. I used to be a runner. So sometimes if you're running, especially upwards of 4, 5, 6 miles each time you're running, and your gut's not feeling great, dialing that back a bit might be something to consider. Now, some people are just obsessed with running and love running. And I mean, weighing the pros and cons of cutting it out for 3 or 4 weeks or dropping it down, really decreasing the frequency or maybe the total amount of time you're running could be an interesting experiment. Some people again are just unwilling to do that. I found like in runner circles, and it could hold them back. And I wonder if that was like at all at play for me when all my symptoms peaked. It's funny thinking about it. When all my IBS situation peaked, I had graduated grad school, and it was kind of a stressful last project. I had a partner that for my capstone project, we were working with local companies who literally didn't do anything. So I did everything for this capstone. And then I start my first big girl job, and me and this other guy, my boss, started on the same day. And we were the only 2 analysts at this company. Basically, essentially, I was working with senior VPs and stuff that wanted certain data points like right away. There was just a lot of stress for a first time job. And then my boss parted ways with the company, and he was great. And then it was just me as like the analyst at this company. So it was pretty intense from a job that I was starting out of school. Then I was running like 5 to 6 miles, maybe 4 times a week, 5 times a week. I think my calories were deficient. I think
and then you had some antibiotics at some point. I remember that.
Well, that was like that was kind of after the major implosion, but leading up to everything, I moved in with some friends. So we were like drinking a little bit more heavily than I was used to, and probably eating differently because we were in this really popular area in Cincinnati. So it was just like a lot at one time that just culminated and was a perfect storm. And yeah,
It
go
goes
ahead.
back to that idea of the pie chart, right? I
Right.
think
Right.
the way that people often think about root causes is there's one root cause, I was fine one day and not fine the next. But really, it's usually this buildup of, oh, stuff's getting a little weird, but I'm coping. Stuff's getting a little weird, but I'm coping. I'm coping. I'm coping. And then, boom, I'm not coping.
Right.
Because it's the proverbial, straw that broke the camel's back. And it's not necessarily the straw's fault per se. Like you might have been able to
Right.
handle that straw if the camel was otherwise, not
Right.
carrying anything. But the fact that you had 500 pounds on the back of that camel and then you added one more straw, that was the problem.
Right.
Or again, like in my cliff metaphor, you inched your way to the edge of the cliff and you had 1 foot on the ground, 1 foot like out in the air, out over the side of the cliff. It's like 1 foot over the grave, 1 foot on a banana peel, so to speak. And then something came along and just blink, and
Right.
off the cliff you go. And then that was the thing that triggered, whatever you struggled
Right.
with. So, yeah, I think that's the way it usually happens. I agree. I think that the single root cause doesn't happen nearly as frequently. And honestly,
Yeah.
even the things that seem like a single root cause, like the food poisoning or, PPI use, a lot of times there's something going on prior to that too. Like, well,
Yeah,
why
like-
did you develop reflux and you were at a point where you needed a PPI?
Right.
Like, yeah,
Or
maybe
why-
the PPI caused the IBS or caused the SIBO, but why?
Right.
What was leading up to the point that you needed a PPI in the first place?
Right. Or even food poisoning. Like, why did you eat the same food as 4 other people and they're fine and you're not? Like,
Yeah. Yeah, that
there's
can
questions
happen
like
too.
that too, which is always interesting. It's like, oh my
Well,
God, you ate the same meal and 2 people are horrendously sick and the other 2 are like, we're good. And
Yeah.
screw those people.
Well,
As someone that had food
Well,
poisoning.
it goes
Recently.
back to what is it? Louis Pasteur said on his deathbed, supposedly, who knows, that it's not the germ, it's the terrain that matters.
Right. Right.
There's going to be some germs that matter a heck of a lot more, like Ebola.
Right.
But there's also a lot to be said for the host's resiliency. And even there are people with dysbiosis walking around and they feel just fine, just like the
Right.
herniated disc people. There are
Right.
people with herniated discs in their back, and there are people with wicked dysbiosis, and they feel perfectly fine.
Right.
And then there are people with minor herniated discs or minor dysbiosis states, and they feel utterly miserable. And there's so many of these conundrums out there. Again, like somebody who's hypothyroid and they feel like garbage, and then you meet the occasional person who has a TSH of like 8, but they feel fine, and they're like, "Huh, I'm hypothyroid," and you're like, "Yeah, like pretty noteworthy hypothyroid,
Right.
man." So, yeah, this sort of stuff fascinates me. I think it's frustrating probably to researchers because again, they're looking for this clear, clean, like everybody who was hypothyroid felt this way and everybody who was not hypothyroid felt this way.
Right.
But you know that there are these weird anomaly people.
Right. Like the 10%.
Yeah. And don't we all want to be them? But I'll say too, I'll share this and then we could get into some supplements. You and I might be robbing our listeners and robbing our clients of something. And I want to just acknowledge that and apologize, but also I have no intention of changing the way that I'm doing things. Placebo works for all medical conditions like 30% of the time.
Right.
So I will acknowledge that there is this element where, there could be the biggest phony going in your town. Like, the doctor who diagnoses every single human being with SIBO. And they're doing antimicrobials out the wazoo. And they're just indiscriminately murdering the microbiome left and right. And they're telling everybody, but they're so confident and they're so certain about their asinine
Right.
ways that that instills confidence in the patients who go to that person,
Right.
right? Like if you are suffering and you go to a doctor or whoever, if you go to them and they do testing and they show it to you on paper and then they talk to you about it and they're like, wow, we found it. This is definitely what's going on and we're going to get you better in 2 months. Here's the exact protocol, everything you need to know for the next 2 months. Let's go get it. That instills a crap load of confidence in people. And if nothing else, even if their protocol absolutely sucks and makes no sense, they're going to instill confidence in their patients and they're going to tap into that placebo effect and they're probably going to cure like 30% of people. And I feel like and I think probably you too, but I am robbing my patients of that experience because I'm always the person that's like, well, here are some test results, but these tests are really imperfect and they don't tell us everything. And here's what we can noodle on and here's what we can debate. And we're going to need to test stuff and see how you feel. And like, here's a supplement that was shown to help 70% of people with IBS. I'm never claiming that any single tool or any single test helps 100% of people with IBS or SIBO or whatever. I'm always like, this has been shown to help a fair amount of people. Let's see if it helps you. But again, I think I'm robbing people of that placebo experience. So sorry, not sorry, but I feel like I would rather be honest when I work with people, even though the naivete or dishonesty, one or the other, that does have some weird value at the end of the day.
Mm-hmm. Yeah, I agree. It's interesting.
It is what it is. I don't know. Placebo's pretty cool. And we should do an updated mindset episode down the road because I think talking about some of the research on mindset kind of stuff could be pretty wild and pretty cool to cover, but that's for another day. Do you want to close out with just a handful of supplements that might be worth trying? I'll suggest we could maybe go back and forth a bit, but I'll throw out there chamomile tea. It's a prokinetic, it's anti-inflammatory, it tastes and smells totally delicious. You can get like a 1 pound bag of chamomile for like $20. And it's a very cost-effective intervention, but that can be very helpful as a starting point. I
mean, I think depending on what's potentially going on could also determine what supplements are going to be helpful. I think, again, if there's like a stress contingent, you could think of different things that might help with stress, like adaptogens or nervine types herbs like chamomile. And chamomile is a prokinetic, has a lot of different diverse effects, which makes it awesome in so many ways. I think, thinking of digestive aids can sometimes be really helpful. So like HCl, depending maybe enzymes as like a symptom management tool. I think especially with diarrhea, I know we've been talking about it more lately, like immunoglobulins can be helpful, things that just help suppress inflammation. I find that they can usually help with like pain and just, again, helping to solidify stool, in particular with diarrhea. It can help with constipation too, depending on the client, but definitely if you're more of a diarrhea presentation, IgG or SBI type supplements can be helpful. They do bind to a lot of the toxins that microbes make. So what that does is it allows the immune system to kind of like take a breath, is how I picture it. The immune system to settle down and recalibrate somewhat, so it's not firing at everything with such an intensity. So that's generally how I've heard that SBI works. That's probably the biggest piece of it, of the puzzle of how it's helping things, is it sort of binds up some inflammatory toxins within the gut and calms everything down a bit. But yeah, I like that a lot for diarrhea.
Ginger also.
Ginger,
you could get
ginger's
ginger
amazing.
In capsules. You could make it as a tea. You could just put it in your food. Again, anti-inflammatory, prokinetic, digestive aid. Really, really helpful there. Probiotics certainly can be helpful. I think that there's probably two types of people listening to this episode right now. There are the people who have been scared to death of probiotics because they were told that it will feed the SIBO or it'll contribute to the SIBO. But we just talked about how most of you probably don't have SIBO anyway. So congrats, you don't need to worry about that anymore. Even though that's not even a actual thing that happens anyway.
I think it's an interesting comment because, again, like, what if, like, true bona fide SIBO from the past, you know how you talked about the cutoffs were so much more rigorous? Who knows? Like, maybe those people, probiotics are not great for. I don't know.
Maybe.
But, like, for what we typically see, probiotics are usually very well tolerated. They're not going to set you back, or...
Well, I don't even know if I agree with that. I think that sometimes tolerance is a little touchy. I think it depends.
Tolerance can be touchy. I don't think, when I say set you back, I don't think it's going to feed the SIBO per se.
No, you might feel crappy for like a day or two at worst.
Right.
And then you should rebound shortly after that, typically. I think that with probiotics, like a lot of other strategies, you just need to experiment and kind of see what happens and experiment again. And you might not find your perfect probiotic on the first go, but that doesn't mean that probiotics across the board are off the table for you. You could go to like probioticadvisor.com and you could try to find more specific information for what you're dealing with. So like which probiotics are good for constipation versus diarrhea versus bloating versus Crohn's versus whatever. But I think at the end of the day, we have to be comfortable with experimenting. I shared with you, I think more recently, that BioGaia is beautifully researched. It helps decrease constipation. It helps decrease methane. I swear to God, it makes me more constipated every time I try it. But I'm too much of a bonehead. I'm too convinced by the research and I'm unconvinced by my body's experience. So every now and then I try it again and I just laugh every time because it doesn't seem to have that effect for me. So again, no matter what the objective truth might feel like, whether it's from your test results or research, you still need to listen to your body at the end of the day, and nothing's going to trump that.
Right. Yeah. And I was saying to you too that more recently I tried a probiotic and I feel like I've had more of an anxiety response when I've been on it. Like I've tried it 3 or 4 times and each time again, it's not that I'm even thinking that is a possibility, but I'm more anxious in the evenings post taking it and thinking like, oh, that's weird. Like nothing has triggered this in any way. What's going on? So that is really interesting to me. And I haven't historically had that with other probiotics. So it is really interesting depending on the environment in the terrain and maybe your genetics and what's going on internally with different... Right, with different strains. Different strains are going to help with different people. Now, again, I've had success with lots of different strains before, but maybe this particular combination with what's going on in my body right now just isn't working.
Well, and again, like this is why we keep harping on experimentation. It's not to say that we don't believe the research or we don't think the research has value. It's not even to say that lab testing has zero value. I think that there are still some decent tests out there that you can go back to. But experimentation at the end of the day is going to be your single biggest tool. And listening to your body, but not to a point where you're like hypervigilant and freaking out about it. I think that also is going to be a huge piece for this. And honestly, like with the probiotic thing as a quick tangent, this is why I have a lot of people do my probiotic speed dating. It's a royal pain in the butt for me because I sit there in my living room with like a big folding card table. And I kid you not, I have like 20 bottles of 20 different probiotics. And I sit there and I put 2 pills of each in a baggie, label it. And I make up these tester baggies with like 2 pills of each of like 20 different probiotics, and I put them all in a bigger Ziploc. And I do that with a lot of my patients, and I do it with my FODMAP Freedom students. And it's because I know damn well that experimentation is the key here. And it's like a really low risk opportunity to just rapid fire, try a bunch of different ones and see what lands well and what does not land well. But yeah, it's it's just another thing that we don't have that much knowledge on. For all the research we have on probiotics now, we're going to have like 57 times that much research on probiotics 100 years from now. So maybe more even, honestly. So we just don't know what we don't know. And we're at a point where we don't have all the knowledge in this particular field of study. And we just have to deal with that and listen to our body. When in doubt, listen to your body. But my darling, my sweet, my angel, my honeypot, would you like me to read you something to close out this episode?
Yes. The only other thing I would say is prebiotics, which...
Oh, yes.
Yeah. So like GOS, PHGG,
yes,
2FL. I mean, there's a lot of different options that you could do, but once you... I do think that there's research evidence to support this and just anecdotal evidence with our clients that prebiotics can be really helpful too.
Yeah, I'm so glad you mentioned that. Also, I will say I've had some pretty good luck with some of the gel-forming prebiotics like psyllium or glucomannan. And oddly enough, those can help with both diarrhea and constipation. Right? Because like it adds some gel and some moisture and some bulk to the stools for constipation, and that helps them kind of slide out easier. But also, when you have loose stools and there's not really a lot of form to the stools, if you could kind of bulk up the stools with something like psyllium or glucomannan, I've had some people with diarrhea who did really, really well with those as prebiotics as well. Not to mention any microbiome modulation that they might be doing. But yeah, GOS has good research helping people with IBS, and it's usually pretty well tolerated. PHGG famously helps decrease methane and can help with constipation, obviously. So yeah, those are 2FL, also kind of relatively new kid on the block, but that can also be very helpful. So bravo to you for derailing me momentarily so that we could cover that. But now, are you ready for my latest?
I'm ready.
Okay.
I'm ready.
Okay. I don't know if this, I'll just read it to you as is. So this was in one of our neighborhood Facebook groups, and it starts out, I can't shop at Costco anymore. Yesterday, I was at Costco buying a large bag of Purina dog chow for my loyal pet, Neko, the wonder dog, which weighs 191 pounds. That is a big freaking dog. I was in the checkout line when a woman behind me asked if I had a dog. What did she think I have, an elephant? So because I'm retired and I have little to do, on impulse, I told her, no, I didn't have a dog. I was starting the Purina diet again. I added that I probably shouldn't because I ended up in the hospital last time, but that I'd lost 50 pounds before awakening in the intensive care ward with tubes coming out of most of my orifices and IVs in both arms. I told her that it was essentially a perfect diet and that the way it works is you load your jacket pockets with Purina nuggets and simply eat one or two every time you feel hungry. The food is nutritionally complete, so it works well, and I was going to try it again. I have to mention here that practically everyone in the line is now enthralled by my story. Horrified, she asks if I ended up in the intensive care because the dog food poisoned me. I told her, no, I stopped to pee on a fire hydrant and a car hit me. I thought the guy behind me was going to have a heart attack. He was laughing so hard. Be careful what you ask retired people. We'll come up with anything because we have the time. Can you even imagine?
Oh my God.
The Purina diet.
I cannot. That's pretty good.
It was tangentially related to nutrition, so I figured I would share that one. Maybe not as good as the ranch, but
not as good as the ranch Subway story, which I need to circle back and figure out exactly which episode that one is.
I think it was Advanced Candida Strategies. I think it was the second recent Candida episode.
Okay, because that will always tickle me about the ranch.
Me too. But I need to cut us off here abruptly because we've had some recording issues today, and I think that we're going to get cut off again if we don't end the recording here. So, guys, sorry for the abrupt ending, but you know where to find us on the gram, and we will see you in the next episode of the IBS Freedom Podcast. Until then, toodaloo.